The feds have approved Wisconsin's reinsurance waiver request. This started back in January of this year when Governor Walker unveiled what he called his healthcare stability plan in his State of the State address. While legislation was drafted quite quickly, one piece of that was to create a state reinsurance program. The legislature approved it and Scott Walker signed it very quickly, but it wasn't a done deal. It had to go to the feds for approval in the form of a Section 1332 innovation waiver, part of the Affordable Care Act that waives some of the requirements of the Affordable Care Act so states can be more innovative. Now, reinsurance generally across the board has been seen as a good idea. It was part of the original Affordable Care Act. On the federal level, there were funding concerns and a lot of political rancor over how it would work. So states have started adopting the 1332 innovation waiver path to create state reinsurance plans. So that's what Wisconsin did, even though at the very same time Wisconsin joined a lawsuit against the Affordable Care Act. So politics have continued to be at play. The reinsurance waiver went into the feds, and on July 29th, it was approved. Wisconsin has asked the federal government for a 5-year plan, a combination of state and federal money to create the state reinsurance program, and the feds approved that. The federal money split it's about $200 million that we're talking about, mostly federal money. Now, the federal money comes in the form of money that is saved from paying out tax subsidies. So if premiums go down a little bit, the federal government doesn't pay as much in tax subsidies to marketplace plan participants. That money instead goes to the reinsurance plan. So there's a lot of moving parts in how this is funded. One of our concerns that we'll talk about in a little bit is where the $34 million in state money comes from. If we don't have enough federal money, if there aren't enough savings from those tax subsidies, the state, by the way that this reinsurance law is written, the state has to pick up the slack. Now, to implement the Wisconsin Healthcare Stability Plan, it's going to fall on the shoulders of Wisconsin's Commissioner of Insurance. He is responsible for setting the attachment point, the reinsurance cap, and coinsurance amounts. So basically, determining how coverage can work for claims between $50,000 and $250,000. And the reinsurance is supposed to pay about 50% of the cost up to until we reach that $200 million point, the total budget of the reinsurance plan. Other concerns, like we said, reinsurance generally is seen as a good idea, a way to bring in a little bit of support to stabilize insurance marketplaces. Concerns in Wisconsin's particular draft is just making sure that premiums actually are reduced, that the savings that are generated by the insurance plans get passed on to the consumers. That has yet to be seen, and the proof just might be in the pudding of how this works. The funding mechanism, like we said, is again the more concerning part. Where is that state money coming from? Each state that has requested a reinsurance plan has done this a little bit differently. Some have done assessments on insurance companies to generate the state contribution. Wisconsin is pulling from GPR, general purpose revenue, in the form of money left over in the Medicaid budget. So if we can save money from our low-income Medicaid patients, that will go to subsidize our more expensive private insurance patients. So this could be a big concern. It could be seen as an upward redistribution of wealth in taking money from the low-income programs to sponsor a little bit higher-income consumers, something that we're paying really close attention to and still have concerns about, even though this has been approved. Another concern that hasn't really been addressed is the broad delegation of authority to Wisconsin's Commissioner of Insurance. Not only is he administering this plan, he has the ability to write his own rules. There's a broad delegation of authority to the commissioner to write the emergency rules he needs to make this work without public input, without this being very transparent or even going through the legislature. It kind of gives some legislative rulemaking power right to the commissioner. We're going to be paying attention to that as this moves forward as well. Finally, as with most of these state reinsurance plans, while they might be kind of ticking away a little bit on the premium cost, they're doing nothing to address the rising cost of healthcare overall. It's kind of just seen as kind of kicking the can down the road a little bit longer. You can read the full federal approval letter to Wisconsin. We have it linked here in the description below. It starts January 1st, 2019, and we'll be coming back to you with updates of how it's working once it's implemented. You can send us a question or your story. What do you think reinsurance will look like once it gets rolling in Wisconsin? And you can do all of that at healthwatchwisconsin.org.